Hey guys, I was just gonna give a update on my shoulder surgery. So it's been almost a year. So I had a medium-sized tear in my rotator cuff, the supraspinatus, which is the top one, and then a slight tear in the front tendon. And they went in and cleaned it out. Cut off bone spurs and sewed it back up. And so I'm about a year out. I can do the bench press. I can do the shoulder press. I've been pushing pretty hard on the bench press. Shoulder press, I've been doing, medium to a little bit heavy. But overall, the pain for the most part's gone. The MRI revealed that it was almost a full thickness tear, but it actually was a full medium-sized tear when the surgeon went in there. So my recommendation would be to just get the surgery done if you're in pain, because really the pain was what drove me to the surgeon. I was sleeping on the opposite shoulder, not even on the surgical one, and I had pain in my shoulder. So I'm really glad I did it. The sling was brutal, having to be in that sling for, I don't remember how long it was, but it was just, sleeping on one side. But it was definitely worth it. So I feel fortunate. I, went and saw a couple different surgeons, and, anything could go wrong, but it went right. And I'm really glad I did it. I had a ton of pain. Another thing to consider too is the way society is right now. I would get your medical work done now, because who knows what the United States is going to be like in 1 or 2 years with inflation and all the other stuff going on in the world. So I did it. I can yesterday I swam 10 laps. I did shoulder press, bench press. I don't have any pain today. I remember there was a time when I could barely bench press 100 pounds, and that's how much pain I was in. So my recommendation is, again, if you have a lot of pain, go see the surgeon. I did get one shot, and it didn't do anything. Cortisone shot, it might have masked it for a couple weeks. But the other thing with the shots is, I read if you do too many of them, it can deteriorate the tissue. So I didn't really I actually put off doing a shot for a year, and then I did one, and it didn't really do anything. So anyways, guys, that's my update. I had a positive result. I'm 49 years old. When I did the surgery, I feel like I use my body. I like to go to the gym and stay active and stuff. So, some of it's probably just wear and tear, but might as well, enjoy your life while you got it, because tomorrow's not guaranteed. So, that's my recommendation, guys. I had a positive outcome. So, go for it. Again, it was a lot. I've had a lot of orthopedic surgery on other stuff, like broken bones, my leg, my foot, my arm, my other arm, broke my back. And this was really challenging to be in that sling, because you can't do anything, and you got to be real careful you don't move your shoulder. So if you can get through that, it's already been a year and I'm done with that. So but it was really challenging. So good luck with your surgery, and that was my update. So I'm glad I did it.